This is a talk for Adler Graduate School course number 537, Advanced Counseling. The topic is the history of parent education in individual psychology. Parent education in individual psychology is built on Alfred Adler's early belief in preventative care, his belief in education as a curative process, and his desire and skill to share his knowledge and skills with others. In 1903 and 1904, Adler wrote a series of editorials on the physician as educator, in which he, quote, wanted physicians to practice preventative medicine in their daily work by becoming psychologists whose knowledge of child development would help them steer young patients away from the path of future illness. Adler organized educational guidance clinics as an adjunct to the Vienna school system beginning in 1919. His format was to meet with groups of teachers and have one discuss a child who was creating difficulties in the classroom, including an inquiry into the case by Adler. Next, the parents and the child were brought in and interviewed by Adler in front of the group of teachers. After the family left, Adler would discuss the case further with the teachers, using it to teach the group about the principles of individual psychology and its application to the specific child. Quote, the child guidance clinics that Adler developed were called Eishungbruchstellen, which translates as Advice Centers for Bringing Up Children. End quote. This format proved to be popular and effective. As teachers learned individual psychology principles, they were able to apply them to the other students in their classroom. Soon, parents and other mental health professionals were added to the audience. The efficacy of this model was recognized in the educational mental health community, and Adler was asked to join the faculty of the Pedagogical Institute of Vienna in 1924. Other professionals formed teams to implement this child guidance model, and by the time the fascists closed them, there were about 30 clinics in operation throughout Austria and Germany. We have few resources from this area of individual psychology practices. An article by Holub presents several cases in the form of scripts of the interaction between an advisor and the children and parents. We don't know if the advisor in any of these case presentations is Adler, but this article represents the best available resource for understanding how the advice centers for bringing up children worked in Austria and Germany. Rudolf Dreikurs attended numerous child guidance demonstrations and became a core member of the professionals who were setting up new clinics as he was completing his internship and residency in psychiatry. He left Austria in 1937, the same year that Alfred Adler died, settling first in Brazil for a few months before going to Chicago. America had a history of child guidance clinics akin to Adler's, but by the 1930s, psychoanalysis had taken them over and individual psychology theory was unwelcome. Dreikurs pursued his aspiration of implementing those advice centers for bringing up children by reaching out to a public school in Chicago, by opening a clinic sponsored by the Unitarian Church, and by affiliating with Hull House. Over time, Dreikurs' numerous students spread out across North America and began practicing and teaching individual psychology. For example, he was invited to Eugene, Oregon for the summers of 1957, 1959, 1961, and 1963, where he provided training to teachers and psychologists and established a child guidance clinic. A guide for establishing centers was published by the University of Oregon. There were also active groups forming in Wilmington, Delaware, and Minneapolis, Minnesota. In 1964, Dreikurs published Children the Challenge, along with Vicki Soltz, and it proved to be, quote, an excellent vehicle for study groups, end quote. 3 years later, Solz published a leader's manual at the Alfred Adler Institute of Chicago that was designed to guide parents in the process of forming and leading parent study groups. It included techniques of leadership, questions for each chapter of Children the Challenge, and an outline for reading the book in 10 weeks. Numerous students of Dreikurs have adapted his basic framework for parent education, writing books and journal articles and structuring parent education curriculum. These include systematic training for effective parenting, active parenting, positive discipline, and raising kids who can. The parent study group model was originally designed to be led by parents, and these curricula are in the self-help genre. But many individual psychology professional practitioners have provided parent education in an individual and group format. When presented in a group format and professional setting, parents often discuss their own children, and the process of the group resembles the demonstration format of the earlier child guidance clinics in Vienna.